Visceral fat. The dangers run deeper than you think. So, hey guys, it's Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle, cellular medicine, and so much more. So, I've been talking a little bit about visceral fat, and more people are fortunately starting to realize how bad this is. We all want to look better, feel better, etc. But one of the things we did pay attention to is body composition and the deep visceral fat. 'Cause sometimes it's beneath the surface, and that's why I made the title. It runs deeper than you think, right? We know that controlling body fat plays a very important role in long-term health. But again, visceral fat is especially dangerous and associated with actually a lot of serious health factors if left unaddressed. A lot of people think that it's just appearance, unlike the fat that you could pinch, that subcutaneous fat, and you need like your arms, your thighs, your love handles. It's just below the skin. It's called subcutaneous fat. That's actually, it's not good, but it's not as bad as the visceral fat. The visceral fat is even deeper. It's less noticeable from the outside, but it's more important to manage for long-term health. So again, what is it? It's that deep fat located deep in the body that surrounds your organs. It's in a layer called the omentum. It's this protective layer that covers your organs, is underneath the muscle. So it's like if you can pinch it, it's usually a subcute. If you feel it deeper than the muscle, it's just kind of that thick belly, that thick waist. It's deep in there, right? And that's where it's around the organs, and it's basically in the truncal area here. So, and it's all across, unlike subcutaneous fat, it's all across the body. Visceral fat, again, is concentrated in the abdominal cavity. So, and it's very close, again, to these vital organs, especially the stomach and the liver and the intestines. And that's one of the issues that's close to the liver, and it can affect the liver. And the liver is so important for everything related to your health. And it can lead to a fatty liver and a pretty much fat everywhere in your body, what's called ectopic fat deposition, where, and this is topic for another day, but it's basically when you're having too much fat, you can't break things down. Too many fatty acids or breakdown products of fat in your system, you're insulin resistant. The fat has to go somewhere, and it goes to your organs, and then it creates more visceral fat, and it's a vicious cycle. So again, basically, to get too much fatty acids and glucose floating and sugar floating through your system, it can enter the bloodstream and accumulate in the arteries, and it can lead to narrowing of the arteries called atherosclerosis, and again, fatty liver, and so much more. That's the reason it's dangerous, right? Visceral fat is linked to health concerns like high blood pressure, heart disease, diabetes, metabolic syndrome, people with elevated cholesterol levels, breathing issues like obstructive sleep apnea, and so much more, like arthritis, cancer, so many things. So it's linked to actual health. So it's not just an appearance issue, it's actually a very serious health issue. And that's the problem. And that's why it can be so dangerous. And that's why I harp on this so much all the time in terms of body composition. Getting rid of that dangerous visceral fat is associated with the risk of increased death. And that's what we don't want. We don't want you to die, right? Research has shown that, women who are considered to have a normal body mass index, yet had a larger waistline, had an increased risk of dying from cardiovascular disease. And the same with men. So visceral fat is a sneaky overlooked health issue. And if it can go unnoticed with typical standards of measurements and scale measurements, BMI, and things like that. And again, it also has an inflammatory effect. Like muscle, it's an inflammatory organ. Visceral fat and deep fat cells itself, fat tissue is very active metabolically. It's actually an endocrine organ. It affects the immune system and everything else about your body by releasing these chemicals called cytokines, which have a lot of effects on the body, but typically they're inflammatory, meaning they cause problems. And again, we all know that inflammation is the root of most health conditions. It can lead to the risk of all these conditions that I mentioned earlier. They can cause blood clots, further worsening insulin resistance, hardening of the arteries, cancer, and so much more. So that's why we want to get rid of this visceral fat. Another reason is, as I mentioned, it's close to the liver. It can lead to fatty liver, which of course can exacerbate the problem. So what causes visceral fat? So there's a lot of things that can cause it, but one thing, of course, similar to the subcutaneous fat, and like it comes down to the root cause, right? Lifestyle. If you're just eating too damn much, or the wrong foods at the right time, or just too much of anything, you're just going to accumulate fat, and it's visceral fat and subcutaneous fat. Visceral fat is also influenced by age. As muscle mass decreases and fat increases with age, as we slow down, or metabolism slows down, or lifestyle changes, it can make this visceral fat accumulate. And again, it picks up at a more alarming rate, both in men and women, but even in women, from quadrupling between the ages of 25 and 65. And speaking of that, also changing hormone levels can also be a cause for this as well. In women, for example, fat accumulation in the abdominal area can take over as they go through perimenopause and menopause, mainly from the drop in estradiol levels. And this is why women start to accumulate that. That's why we do bioidentical hormone therapy with estradiol and the other hormones. It can get rid of this visceral fat in the abdominal region. Genetics can play a role. And sometimes there's a hereditary component. People have like that apple versus pear body shape, right? But again, it's usually more a lifestyle, and changes what you do, how you move, how you sleep, what you eat, when you eat, and of course, hormone levels dropping as you age and optimizing them. Regardless of the cause, so we're addressing this visceral fat is crucial. And the next question is, how do you measure this, right? CT scans and MRI scans are the best way, but obviously not everybody has access to that, or sometimes they're very expensive to do. But obviously there's things you could do, right? Measurements, body shape. Again, people refer to it as that apple shape, have slimmer legs and a larger trunk, often have more visceral fat. You see that in men, but you also see in women, but sometimes both. Waist measurement is big. In general, women who have waistlines of 35 inches or more, or men with 40 inches or more waistline have believed to have higher concentrations of visceral fat, right? And some people think those measurements should be dropped a little bit, but that's a good ballpark to shoot for. You want to be less than that because that's an indicator of visceral fat. BMI has been around, of course, forever, but there's some pitfalls to this. But again, it's just a guide. There's some online calculators you can plug these in and kind of get a rough idea. Then, of course, you can do things like body scans, body composition analyses, like the DEXA scan, the dual X-ray absorptiometry it uses beams that run through the body to measure composition, including bone density, muscle mass, and fat mass. Sometimes a little expensive and they're hard to find, but there's other products and companies and machines that do this, like the InBody scan, the SECA scan, and of course, there's a lot of these little scale devices that are not quite as good, but it gives you a ballpark. The InBodies are probably the most well-known. They're really simple to do. The last question is, how can you get rid of visceral fat? Yes, of course you can. It's not just about restricting calories, increasing exercise, right? This is important, but you have to have a more tailored approach. And often the guidance and expertise of clinical experts like myself or my colleagues is necessary, because sometimes people are just doing everything they can. They're fasting, they're eating this, they're eating that, they're doing this exercise, and it's still not working, right? But sometimes dietary changes alone will deal with it. Research has shown that restricting calories didn't always work, right? And it's not simply what we eat, but also when we eat and how we eat, and monitoring certain foods, right? Obviously, removing processed foods, trans fats. Some people need to eat more or less saturated fat. Some people need more or less carbs, but it's not as simple as that. There's no magic diet like the keto or the carnivore. These are restrictive diets that just don't work long term. They're good short term, but those are just quick fixes. It's all about lifestyle and finding what works for you and tailoring it to your approach and monitoring and tweaking and changing as you go through the day, through the week, through the month, through the year. You want to burn off that visceral fat. And oftentimes what happens is we have to treat the hormonal environment and the metabolism. Metabolism can change, hormones can change. We have to address that. This is why I do what I do with bioidentical hormone therapy and sometimes peptide therapy, to address the root causes and then address underlying issues that are leading to that. Maybe there's micronutrient deficiencies or gut inflammation. Everybody's talking about the microbiome. Oftentimes people have an inflamed microbiome. We need to fix that first. Of course, we recommend moderate exercise, walking daily, high intensity interval training, strength training. These are absolutely crucial. And of course, eating a whole food based diet, again, to avoid all the processed foods and excessive caloric excess, right? If you combine aerobic and strength training, it's going to improve all these parameters, reduce your risk of insulin resistance, improve your blood pressure, reduce your risk of obesity, and much more. So again, for this reason, it's best to work with an experienced team with knowledge not only in visceral fat, but also nutrition, metabolism, hormones, and more. So losing fat is not just a body issue. It's a key tactic to optimize your health, not now, but also for the future. So these goals can become more achievable when you have expertise and support of someone like the Primax team. Shameless plug for myself, but any of my colleagues can do this as well. But I basically really create personalized plans for my clients and help you feel 10 years longer, drop that weight. Most of my clients are feeling more energetic. They're dropping their fat. They're sleeping better, have more libido, mojo, thinking more clearly, and much, much more. So if you're interested in working with me, just DM me below and I'll reach out to you. We can one-on-one, we can have a quick call and see if you're a fit for the program. I'm happy to help, but visceral fat is definitely achievable, but there's no quick fix. It's a combination of lifestyle, proper diet, eating the right things at the right time, proper exercise, and addressing the underlying metabolism and hormonal issues that are a problem. And that's where the medical side comes in. And there's no quick fix. You're not going to get this from Instagram gurus who claim to be hormone experts. You have to work with a qualified medical professional who knows what they're doing, because it's a lot deeper and a lot more nuanced and complicated than it seems. And I see this because myself and my colleagues, we see these people all the time when we're getting on these regimens from these social media gurus or these hormone mills, and they get broken, they get damaged because they try to do the same thing, or they just do a quick fix. Think, oh, you just need this and this and this, and it just doesn't work that way. There's a lot of nuance to it, and there's a lot of moving parts. It can be very, very complex. But the bottom line is visceral fat can be fixed if you're doing the proper lifestyle, addressing the hormonal deficiencies, any nutrient deficiencies, optimizing lifestyle. It can be done. We'll get that visceral fat off, improve your health, prevent all these long-term health issues that I mentioned at the beginning. So if you're interested, again, check me out, drericprimax.com. Also, all my social media sites. I've got a ton of free information, free books on my website, drericprimax.com. I'm doing telemedicine all across the country. So please reach out to me if you're interested in working with me. And again, please like and share this post because visceral fat is a big, big problem, and we need to address this across the nation. America's getting fatter and unhealthier, and we need to turn the ship. That's why. So if you want to join the Primex tribe and get lean and healthy and feel your best and look your best and help others to look their best, and again, live to give, do something nice for someone, pass it forward. So hope you enjoy this, everyone. Have a rocking day, and we'll talk to you soon. Thanks. Bye.